Another question I had and I'm not sure who wants to answer it. Colleen asked it, and I was also thinking the same thing, is how that story that you were telling about the patient who didn't want to take his pain relief, because he needed to have his capacity to make the decision to take his medications. And I know that that will resonate with so many of the palliative care nurses here because it resonates with me, that moment where you're just like, gosh, this isn't how I would want it for you. How do you help your patients navigate? Oh no, sorry, help your nurses and staff navigate that? Big question.
Do you want me to do that, Katie, or do you want me to?
I'm happy to maybe start with that question. I think, look, sometimes we have seen when patients are symptomatic, but they're very focused on their capacity, that they may kind of say, I'll hold off because I want to make sure I'm about to do an assessment, or I'm about to start the process, that actually my capacity is more important than my pain. And I think it's that trust that we build with patients in how we kind of manage their symptoms, and they trust they have in us to manage their palliative care needs while we're also supporting their VAD needs. And I think the second part of that is also that, sometimes it's one of the most challenging things as palliative care nurses, that, we have our own image of palliative care and what a good death is. But it's also important that we always keep in mind what is a good death to that patient. And that may be different than necessarily what we view, but really what's most important to them is also important for us to support as well. So it can be a delicate balance, but I think, always keeping in mind that as part of palliative care is supporting a good death in what that person as an individual sees as a good death as well.